Ever since the bubonic plague in the 1500s, rich people have been able to use their wealth to avoid diseases. The poor have always been the victims of any epidemic or outbreak. Today, as the coronavirus Covid-19 spreads across the globe, the 1% are spending their cash to keep themselves safe at our expense. During the plague, the wealthy fled the cities to their mansions in the countryside, where they could keep their families safe from the disease. They left their poor servants and workers behind in the cities to die. The rich paid the physicians and doctors to leave the cities with them, so the only people left to look after the sick were the priests and the religious orders. Today, the rich are continuing their lavish lifestyles, but avoiding the public by hiring private jets to travel the world. These jets provide them with healthcare and sanitary equipment, and the crew is temperature scanned before getting on the plane. At the same time, public facilities are struggling to source sanitary equipment, and ordinary people are being ripped off by greedy retailers selling hand sanitizers at extraordinary prices. The rich have swapped their country mansions for luxury yachts. There's a boom in the rental of private yachts, both in the Bahamas and the Mediterranean, as the 1% leave us peasants behind on the mainland, while they isolate themselves on luxury yachts. In the time of the plague, the rich wore plague masks stuffed with herbs to try to protect themselves from the illness. Today, the wealthy are buying $60 a piece face masks, despite advice from medical professionals that face masks don't help prevent you catching COVID-19. On top of the rich using their wealth to prevent catching COVID-19, if they were to catch it, they would have a much better chance of recovery. Most countries in the world today have severely underfunded public health services. Neoliberal austerity and privatisation of public health services mean that those with private health insurance or those with money can afford to pay for better health care than ordinary people. We need a society that puts the needs and health of people before the profits and wealth of the 1%.